clashing in England's NHS. In the wake of a global pandemic, government budget cuts and dwindling resources, the healthcare sector continues to be strained. Nurses and student nurses at the front line are bearing the brunt of these financial austerity measures. Today we're outside of Bristol Royal Infirmary, where NHS staff have recently been on strike and in attendance of public demonstration to convey their frustrations. In 2022, UK Chancellor Jeremy Hunt outlined a 2-year plan to increase the NHS budget by £3.3 million across each year, while Prime Minister Rishi Sunak pledged to reduce NHS waitlists. However, as of December 2023, it is evident that no progress to wait times has been made, with the UK Health Foundation charity predicting that, based on current trends, 8 million people could be on the NHS waiting list by summer 2024. Sunak stated that junior doctor strikes made his pledge more challenging, but it takes little investigation into the lives of junior doctors and nurses to see why their patience with the government, whilst they wait on promises for change, is at breaking point.
I think the main concern that I've seen in community as well as in critical care is that the community patients aren't being seen. So if they're not being seen in the community, their conditions will worsen, they'll get infected, and then they come back into hospital. So there's this whole initiative where we're supposed to be doing hospital at home. So they're supposed to be at the home, not the hospital. And we're trying to do preventative measures to stop them from coming in and being in an acute setting. But it's not working because we don't have the staff to go out and see them and give them antibiotics. And then there's antibiotic resistance. So the more we give it, the less it's going to work.
It's been made known across the UK that both seasoned and student nurses are feeling the crushing weight of a struggling NHS. Physical and mental well-being appears to be reaching all-time lows across staff, as well as patient care being incessantly jeopardised. The plight for a better future is taken on by each generation of new NHS staff, but with efficiency savings in place, they are being left with fewer opportunities for mentorship and interactive work experience, potentially hindering their education and preparedness for their careers. I do feel concerned about my future as a nurse working for the NHS. The majority of us students definitely do. I feel like opportunities for hands-on training in hospital for us are becoming less and less frequent. The staff are so overworked trying to care for people that it's hard to find the time. Friends of mine that were still technically students during the pandemic were thrown into the workforce and saw firsthand the NHS at its breaking point. And when we work, we speak to staff in the Bristol hospitals that don't get breaks, have to pay for parking on shift out of their own pocket, and feel totally burnt out a lot of the time. I have so much sympathy for our patients too, who are waiting hours and hours for basic treatment. But unfortunately, with the way things stand, efficiency savings and prioritisation mean that there really isn't any choice but for things to operate this way. So what does the future of our NHS look like? This has been Ella Stott, Bauer Ashton News, Bristol.